our next session, I would like to welcome Dr Ashley Bloomfield. So, Ashley, I've heard you talk around alliancing and the notion of a circuit breaker, all the circuit breakers that are successful components of alliancing. Can you talk a little bit more about that?
Thanks, Keriana. I guess what I have in mind here is the idea of service integration is not a new one. It's been around for, a couple of decades. Yet we've found actually doing it to be quite difficult. And in part that's because of the need for us to really take that system view for the DHBs and the clinicians and managers working in the hospital to be able to work closely, to understand primary care, to have a platform for actually having the conversations, for agreeing on work and for taking it forward. And to me, that's where alliancing has really acted as a circuit breaker. It's provided that, that platform, that mechanism for actually primary and secondary care to get together, to get the baggage on the table, and to get past that, and then to start to agree, well, actually, we're all part of the same system. How do we move that clinical integration forward? So that's, I guess, what I've got in mind there.
Sure. And kind of in your neck of the woods, how do general practitioners or general practice teams view alliancing?
Well, I think it varies, of course, just as it does within the DHBs. Many people within the DHB wouldn't really have any idea what it's about. Some may be sceptical about it. But my experience is that those who have got engaged, either around the Alliance leadership table or in some of the specific initiatives or through clinical pathways work, feel very positive about it. And we've had quite a number of GPs and other clinicians within the hospital, and also other practice staff like nurses be really positive about the experience of alliancing, and in particular their ability to do things that previously weren't possible.
Great.
Yeah.
So to you, what does success look like for an alliance?
Success for an alliance to me is a place where you can have hard conversations, you can put the issues on the table, air your views and agree on a way forward, and then a bit like cabinet style decision making, then you go out and you all agree this is what we've decided, and you go out and implement it. So that's successful alliancing in my mind.
And why do you think that general practice teams or primary care need to get involved in alliances?
Oh, look, I think they're needed to make it successful in the first place. But this is the opportunity. We know that to make our system sustainable into the future, primary care has to really be able to be the health home for individuals and their families. And they've got a huge opportunity here to be involved in what I think is the platform for making that happen.
Great. So in one word, describe how you feel about alliances and why.
Oh, very optimistic. Well, that's two words. Optimistic. But because I think we're seeing the results, and we're seeing change, and we're seeing enthusiasm and energy and better services for patients and for families and communities, and that's to me what it's about.
Great. Thanks for your time today.
Okay.
Thank you.